everyone. Today's session is on guiding families with food allergy stages, practical tools for nurses. This is approved for one contact hour CEU per the American Association of Nurse Practitioners. All right, and today's speaker is Dr. Theresa Bingemann. Dr. Theresa Bingemann attended Rutgers University and earned her medical degree at the University of Medicine and Dentistry of New Jersey Medical School. She then completed a combined internal medicine pediatrics residency at Mount Sinai Hospital. Subsequently, she completed her allergy and immunology fellowship at the Mayo Clinic. She is a professor of pediatrics and medicine at the University of Rochester, where she is a program director for the Allergy and Immunology Fellowship. She is actively involved in fellow, resident, and medical student teaching. Dr. Bingemann is a fellow of the American Academy of Allergy, Asthma, and Immunology, the Quad AI, American College of Allergy, Asthma, and Immunology, and the American Academy of Pediatrics. She serves on the editorial board for the Annals of Allergy, Asthma, and Immunology as a reviewer for several other journals. She serves on the American Board of Allergy and Immunology Board of Directors and on the ACGME Allergy and Immunology Review Committee. She's an active member of several committees in the ACAAI and the Quad AI. Her research focuses on IgE and non-IgE mediated food allergy, anaphylaxis, and physician well-being. Okay, and here are today's learning objectives, and I will let Dr. Bingemann go ahead and take it over.
Thank you so much, Lindsay. I had to laugh looking at that picture because I realize it is the same blouse that I'm wearing today.
Perfect.
Not planned, but it looks like I don't have a very varied wardrobe, but that's okay. Let me just get this from the beginning. Does that look okay to you guys?
Yes.
Let me just move the direction bar is bouncing around my screen, so I'm just trying to move that out of the way so I can see.
Funny story.
All right. So guys, thank you for having me. If you have any questions along the way, feel free to say something, or if Olga, I don't know if you guys use the chat. If you want to put something in there, if someone will let me know if something's there. I'm pretty bad at manning the chat while I'm talking, but if you have questions, I'm happy to try to answer them. So these are my disclosures. None of them are relevant to this talk in any way, and all the relevant financial relationships have been mitigated. So our learning objectives for today are to discuss the developmental aspects of managing and coping with food allergy, to provide strategies for gradually involving children in food allergy self-management over time, and to utilize these handouts that I will be talking to you about. So as you all are aware, there are several pillars of food allergy management, and we really think about prevention and emergency preparedness. And while this sounds simple, a lot goes into avoiding allergies, including reading labels, communicating with wait staff and families, and lots of education needs to occur on the part of the healthcare staff, as well as other people that may be caring for someone with food allergy. They should have an anaphylaxis action plan, be able to recognize anaphylaxis, and carry and use epinephrine. And of course, activate emergency response if needed. But quality of life is really the ongoing measure of food allergy disease burden. And you see here that our life is often surrounded by food, and parties include cakes that a child may or may not be able to eat. You see a Thanksgiving meal in the center, and obviously this can be really stressful for families. And even soccer that you see there in the middle. I remember when my kids were doing youth soccer, and it was, oh, who's going to bring the snack this week? And, you have to consider kids' food allergies, but not everyone might be willing to do that. And I would always bring something that I thought everyone could eat. And so that usually was orange slices or apples or something like that. And my kids would say, well, Mom, you bring the boring snacks. So there are lots of psychosocial concerns involved in food allergy management, and some of that is the impact of dietary restrictions and social limitations on quality of life. The challenges of how do adhere to my management plans but still do things that I want to do or I want my child to do. And there's always in the background some anxiety about potential accidental exposures or reactions. There's a sense of living with uncertainty and risk. And there may be this issue of food allergy relating bullying and the sense of feeling different. And then, of course, even when you're in the medical environment, there's lots of things that you need to think about and prepare for. So things like oral food challenges or oral immunotherapy. And then another thing that's challenging for families is what, how are things gonna go when you're transferring responsibility to other people to care for your child? And we know that parental self-efficacy in food allergy impacts what they perceive as limitations or not. And so, for example, if you look at the slide on the left, you see activity limitation on the y-axis and low worry and high worry on the bottom. And what you can see there is that when someone has lower self-efficacy, there's greater activity limitation. And so that really should inspire us to improve self-efficacy for our patients. And we have to recognize that some anxiety is normal, right? This can help with adaptive vigilance. But when it's keeping people from going out and doing the things they want to do, then we really need to make sure we're addressing that. So the handouts that I'm going to talk about were really based in this idea of a developmental approach. And so why is this important? So we know there's these consistent pillars of food allergy management, but we also know that as a child matures and ages, there's different challenges. I think of the toddler running around and picking up anything they see and putting it in their mouth versus the teen where the parents are wondering, are they going to kiss someone that ate their allergen and then have a reaction? And so obviously the way we talk to people at different times is going to be very different, and the concerns that we have are very different. And our goal in doing this is we all believe, although I don't have a study supporting this, is that the kids that play an active role in their food allergy management over time are the ones that are less stressed and thrive when they go out, and they really live well with their allergen or with their allergies. And so we wanted to see, is there a way that we could possibly replicate that and help support kids and their knowledge over time in a way that would increase safety, decrease anxiety, and also increase confidence. So it turns out that Jenny Lebovich was talking to a mom and about food allergies, and the mom said to her, "Is there a good resource for helping my child cope with food allergies that's tailored to her age?" And Jenny said, "I don't think so, but there should be. Can we create it?" And that's how our group came together. And so all the people listed on this slide were involved in developing these handouts. And our goal really was to develop reliable, evidence-based information focused on balanced coping and inclusion of psychosocial issues. And we really wanted to provide practical tips that were actionable, that people could use over time, and that were easily accessible. So these are actually available on the Quad AI website. They're available in both English and Spanish, and I'll show you some more detail as we go along. So the way we did this was there was a project team of allergists and psychologists, and we based the content on practice parameters, guidelines, published research on psychosocial and developmental aspects of managing food allergy, and our clinical experience. So when we organized these handouts, we loosely modeled them on the developmental stage-based AAP Ages and Stages handouts. And we tried doing the same topics across all the stages with tailored content by stage. And so on the left here, you see the topics that the handouts cover. And so that includes teaching children about food allergy, allergen exposure, label reading, recognizing and treating an allergic reaction, managing food allergies at home, eating out at restaurants, educating other caregivers, managing food allergies at childcare and school, navigating social activities, supporting self-esteem, managing anxiety and feeling confident, preparing children for medical visits, managing food allergies at college, and preparing to manage your health care. And you can see that not all of these things are in every age group. And this is how we chose to develop or divide up the age groups. And you'll see that there's a little overlap here. So we say 0 to 12 months, and we say 1 to 3 years, and then we say 3 to 5 years. We did it this way because depending on where a child is in development, maybe the toddler handout is better for that 3-year-old than the preschool one is. And so we recognize that development is a continuum, and you can't just automatically say that someone's X age and therefore this is going to be best for them. So after we put together the handouts, we did a survey. We gave them to a bunch of caregivers. We did our best to get a diverse group of individuals, which, as has been the case in other things, it was pretty challenging. But we got 57 caregivers of children with food allergy and 2 young adults with food allergy to review the handouts and complete the online survey. And the majority of caregivers said they were likely to use the handouts, they were satisfied with the amount of content, and they agreed that the handouts use elements of plain language writing. So we really tried making this available at all literacy levels. And so this just shows you that the majority of people thought the amount of information in our basics handout was just right, and the amount in the handouts for your child's age was just right. And they basically said, I'm pretty likely to use these. So, what did the caregivers value when we did this? So, they valued the developmental focus, the information about the emotional aspects of coping with food allergy, and the feedback was the content's good, but the handouts are too text heavy, and that we should have ideas for areas where concrete examples would be helpful. And so then we revised the handouts based on the caregiver feedback, and we worked with the graphic design people of the Quad AI. And so this is what the landing page looks like at the Quad AI. And there's also posters that can be printed out. So the handouts could be used in the office, and that you can just use the QR code. And so you can use them for education during a visit. So what do these things actually show? So for the purpose of this talk, I grouped the ages because there is some overlap. And so we referred to the babies, toddlers, and schoolers as supporting parents of the active and curious. Now, as you guys know, children are active, curious, and they need careful monitoring. They pay attention to what adults do, and they learn by imitation and play. And parents are role models. You guys have all seen the things where parents do something, they think the kids aren't paying attention, and then the kids are then saying something that, well, maybe the parent didn't want them to say. And we also think about the fact that having daily routines increases a sense of security, especially for young children. And we really wanted to have simple, safety-focused language around food allergy. And we recognize that at this age, caregivers are primarily responsible for food allergy management, and that we try to emphasize that when parents follow consistent food allergy management routines, children learn that this is an important part of daily life. And we must recognize that it is common for parents to feel overwhelmed, frustrated, and worried at times when a child is first diagnosed with food allergy. And concerns often include, how do I go about introducing new foods? Are they going to have a reaction to that? What will an allergic reaction look like in a preverbal child when they can't describe symptoms? And, are we going to have problems with accidental exposures because kids put so much stuff in their mouth? And so oftentimes family will limit social activities and not do everything, or they might not send their child to preschool because they're worried about food allergy management. And often, though, as parents learn more, they feel more confident and they develop routines that keep their child safe. So, when we're thinking about management, we need to think about teaching children about food allergies, but our tone matters, and we want to use simple terms. So, for example, these are some of the phrases we recommended for using with the young kids. You are allergic to eggs. Eggs can make you sick. Or we have our medicine bag, so now we can go to the park. And then we also recommend explaining routines out loud so that children will learn they are important. So we read the label, so we know there are no eggs in these cookies. They are safe for you to eat. We also want to teach children about not sharing food. And so we talk about role playing different scenarios when kids might be offered food. So they could say, no, thank you, I have allergies, is one example. And it's really cute when I see people in the office. I often ask how are things are going, all those transition times, how do they feel sending their child off to preschool? And it's really nice to hear how often parents will say, my 3-year-old knows they need to ask someone before they just eat a food. And obviously, a 3-year-old is not going to be totally reliable, right? But the more you could get them in the habit of not just grabbing things or asking if it's a safe food for them, at least it cues in the adult that, okay, maybe I shouldn't just be handing anything to this child. The other thing that was really important to us is that we wanted to support children's self-esteem by helping them label feelings and give them simple choices to increase their sense of control, and then praising them for following routines. So some examples we talked about was, it seems like you're mad you can't eat what your brother is eating. Let's find a food you enjoy that is safe for you. Or Daddy brought snacks to the park. Would you like the crackers or the fruit? And great job washing your hands before you eat. And we all know, everyone that has kids knows that, especially in that toddler period, the more you can give them control, if you really don't care if they wear A or B, you let them choose because you're going to have to be more rigid about something else later. Any questions about the little ones? Okay. So moving on to the school-age children, we talk about emerging awareness and involvement. And so we're talking about early grade school and late grade school. So now we're thinking that, caregivers are tasked with developing food allergy management strategies to keep children safe and then also keep them safe when they participate in activities outside the home. But at the same time, children are working on building a sense of control and independence. So parents may start to feel them pulling away a little. And children can understand more about food allergies and follow simple rules. So this is a good age to get kids involved in their management with parental supervision. So gradually including the children in the management helps. And this really does build confidence and helps them manage more independently in the future. Transitions such as school entry that require reliance on other people increase potentially increase the child's responsibility for their food allergy management is often a source of caregiver anxiety. I can think of a number of years ago, I had a 5-year-old on the first day of kindergarten, and this little girl had peanut allergy. Went to school and made a new little bestie. And at lunchtime, the best friend said, "Would you like half of my peanut butter and jelly sandwich?" And the little girl with the food allergy says, "No, I have a peanut allergy." But when she went home that day, she told mom about the experience. And mom called me up and said, "Oh my God, what do we do about this? My child was offered peanut butter the very first day of school." And so I took a step back and I said, "But what did she say?" And, she told me what I just told you. And I said, "You should really commend her. She was listening to everything you were telling her, and she did exactly what you wanted her to do." And so we also talked about having the school reinforce the no sharing food policy. But I was really proud of this little girl. And we hear these stories all the time if we give kids the tools to do so. So, the other thing that happens during this age group is that kids have this special to different transition. And what I mean by that is, for years they've heard, "Oh, I have a special, you have a special treat," something that's just for them. But as they start getting to the school age, they then start to feel more different and don't want to necessarily feel different than any other kids. And so this can sometimes cause anxiety. And also, what ends up contributing to this is that there's greater cognitive awareness of risks. And so, for example, it's usually between 8 and 11 that the kids come in for food challenges and they're really visibly anxious. I always am a little cautious how I'm discussing everything with the parents because these are the kids that I find will often say to me during the first dose, "Oh, I feel something. I don't know if I can do this." And then sometimes we actually get through the entire challenge. The other thing that sometimes contributes to anxiety is that there are many misperceptions about what will happen with casual contact. And the other part that's always challenging in this age group is that this is when, unfortunately, we may see bullying or teasing by peers at school. So, to help with management, we recommend teaching children about food allergies in the same way you talk about other safety issues. So, an example could be eggs can make you sick. We read labels and keep your medicine with us because these strategies work really well to help keep you safe. Alternatively, just like we stay on safe paths and always wear a helmet when we ride a bike, we read ingredient labels and always keep your epinephrine auto-injector close by. We teach children why reading ingredient labels is important. As they learn to read, let them practice with you. And so I've had parents use allergens as sight words. And so that's another way to reinforce the reading, but to help kids with label reading. Other things to remember is it's really important to be consistent with and reinforce important rules and routines. So, for example, if there's no label, we can't eat the food. Or use the bathroom, grab your coat, and make sure we have your epinephrine auto-injector before you go out. And I mentioned earlier, we really advocate for role playing and practice language ahead of time for common scenarios so children feel more confident. And so sometimes we do some of this in the office, but I also have parents do it at home. And so they can say, list their allergies. They might say, if someone offers them something to eat, "I have to ask my parent," or "No, thank you, I have food allergies." In general, families don't have any problems coming up with scenarios because most parents are worrying about a variety of scenarios. And so I usually have them practice those scenarios so the parents feel a little less stressed too. So it's also helpful to have children return to usually allergy management routines after reaction. And so it's important not only to find out what happened, what led to this reaction, but also talk about the things that went well. This is typically a time of great stress. And so when I'm going through these reactions, I always say, okay, well, what can we learn from this? What can we do differently next time to stay safe? And then it's also important to recognize and acknowledge the way children may be feeling. They may be frustrated, they may be sad, and encourage them to come to their parents if they're upset. But at the same time, praise them for all the good choices that they're making, even when they're frustrated that they couldn't have what a friend was having. So then we move on to our teens and young adults. We call this transitioning to independence. And I always find I love the teens. It's always such an interesting conversation. This is the age where we definitely start to see those disagreements in the office. And adolescents, we know it's developmentally appropriate for them to pull away, to focus more on friends and social relationships. And what their biggest, usually most of them are most focused on fitting in with peers. And often, some kids may be self-conscious about their food allergies or embarrassed to speak up in social situations. And so, because they're still going to take cues from you, consider your messaging. So, I think of words that I've heard families use that they use to try to get people to take their child's allergy seriously. But I think sometimes because of how dramatic it is, I think it leads to more fear. And I've also had families say things to me like, well, I know no one can take care of my child like I can. And while I 100% agree that parents are experts on their kids and that they, I'm sure, are well educated and doing great things to take care of their child, if they're hearing things like that, kids are going to be more anxious when they go to school or they go to practice. And so I think we have to be really careful about what people are saying and mindful when we're having those conversations. The other part is I always think about this as we're ultimately trying to raise independent individuals. And so part of that is age appropriate, developmentally appropriate responsibilities for their food allergy management. And so, again, you can ask them about things that they are worried about, the kids, situations they're worried about, and always leave the door open for further conversations. And so the other thing that's challenging about the adolescents is that their environments become increasingly less structured. And so there's typically no more allergen-free tables. The adolescents may be spending less time under direct adult supervision. And there's often, though, a greater awareness of risks. And so when this happens, there may be more worry or hypervigilance. And I didn't realize until several of my son's friends that have multiple food allergies come over that oftentimes I would make sure that I had safe snacks for them. But a lot of the kids would choose not to eat at all when they were at someone else's house. And I remember mentioning it to the parent saying, I'm a little concerned. He might be hungry because he didn't eat anything. And, at the time, the mom said to me, I wonder how often he's going to other people's homes and not eating, even when things could be safe. And so it's important to ask about those things because otherwise parents wouldn't know. The other thing that happens with the adolescents, of course, is that new experiences will lead to new questions and concerns. And I often like to find out what they're comfortable with and what they're not comfortable with. And so, oftentimes by high school age, a lot of kids choose to self-carry. Occasionally, I see kids that really don't want to, or even the kids that self-carry, they may or may not want to self-administer. And so, I think it is important to have those conversations and not make assumptions that just because someone's a given age, that they're going to want the same thing as another child. The other thing to keep in mind is that adolescents, while they have developed a lot of skills, they're still working on their problem solving and organizational skills. And so it's really important to be as clear as possible about management expectations, but collaborate on how to reach those goals. And some kids are going to say, this is how I want to do it, and they might be really great about that. Some kids might need recurrent reminders. Another thing is that not all teens understand their anaphylaxis management plan. I can't tell you how often I will ask in clinic, so, and I've done their teaching, so maybe this is on me, I guess. But the teens, I'll say, so when do you use your epinephrine? And they're like, if I can't breathe. And so, yep, we're probably missing the boat there. So maybe I need to do a better job. But I think oftentimes this message gets distilled into this one-liner that may or may not really be helpful. And oftentimes it's not exactly what the guidance we had provided was. And so the other thing is being clear who's doing what. Some parents will still remind their child every time they go out. Other kids will say, I don't need this. Need you to remind me. I'm all over it. And then there's tension because why are you nagging me? So as a parent of teens, we all have that delicate balance that we need to navigate. And so the other thing is that balancing the parental desires with what a child is comfortable with. And I can't tell you since Zolair came out how many conversations I've had for 17-year-olds who are seniors in high school. They're getting ready to go off to college, and the parents say, I want my child to start Zolair or omalizumab. And the kid says, I haven't had an accidental ingestion in 10 years. I don't think I need it. And the two of them go back and forth. And so I usually provide data in that circumstance and let them decide what they feel is right for them. But it's really interesting watching these conversations. And so then there's the carrying epinephrine. And so whether it's stored at the nurse's office or they're self-carrying, the majority of kids at this age, especially if they have practice and other experiences, are self-carrying. Occasionally I'll hear someone that does not want to be responsible for their epi at school. And instead they leave it at the nurse's office. So then other things in the adolescence, like anything in life, good communication is key. And I often will ask friends, if the teen brings friends to their appointment, I ask them about some of these things. I feel like if they brought someone, they clearly were comfortable with them knowing their health stuff. So I try to find out what's going on. And so typically the friends are really good about ratting them out if they're going to restaurants and they're not telling people about their allergies, or if they're not carrying their epi or their inhalers or whatever else it should be. So I usually learn a lot from the friends. But I also ask kids, how do they handle get-togethers when food is present? Are they comfortable with the plan at school? I don't go through all of these questions every visit, but I usually ask some open-ended questions to get a sense of what's going on. I also bring up the things that kids may not want to bring up. So I often will bring up dating, kissing, alcohol, and just sort of lay it all out there. Occasionally, some of the teens will say, I'll offer to let the teens speak with me alone. Some choose to, some don't. whatever they're comfortable with is appropriate. But I usually try to throw out the things that many kids are worrying about but they might not be comfortable asking about. And then I mentioned about the epi. I often ask them to demonstrate to me how to use it because they say, yeah, 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 I know I have to use it. And so then I toss them whatever device they're having. And then they often look at me and say, okay, it's been a while. Can you show me how to do this again? And then I think the most important thing is whatever device they have is, are they willing to use it? Any questions on that?
We have a couple of questions in the chat. Would that be okay to ask now or?
Sure. Yeah.
All right, so let's see. One of them was from Tina Marie Klein about her nursing students and clinical faculty who are seeing an increased number of patients using nasal epinephrine neffy and their anaphylaxis plan versus the traditional autoinjector. Is there an efficacy difference or any reason one is preferred over the other? And I know one of them, I know Marie said, obviously the needle, is one of the reasons, but if you have any other, insights.
So, all of the epi devices were approved based on studies in people that were not having anaphylaxis. The neffy device, and so most things are compared to either the auto-injectors or a needle and syringe epi. And so they look at physiological effects like elevation in heart rate and blood pressure and times to that happens. And they look at peak epinephrine values. And so the data is favorable for all of those metrics. Now, what they've been doing is giving people, they've done the studies on dogs as well with anaphylaxis, and there are some small studies out of Japan where they have now shown, small, that neffy works. I know the company has also given us some that we have in the office if we want to use it for food challenges. But everything points to that it works just as well. I find it really interesting. I mentioned on the previous slide that I think it's important that people are willing to use and know how to use whatever they have. And I think of my three sons. And so two of my sons will do anything possible to avoid a needle. And so if they needed it, neffy would be the way for them to go. My third son absolutely positively hates anything in his nose, and he will take a shot over anything in his nose. So I do think they work. I do think people should pick what they're most comfortable with. And I think there's a few things impacting why you're seeing more. One, of course, because it's needle free, but depending on insurance, for some people, it ends up being a little cheaper than the other devices. And then the other reason that some people have been more comfortable is that the expiration date is longer. It's about 30 months as opposed to 12 to 18 months.
And I think it's also temperature more stable as opposed to.
They quote give a longer temperature range, a wider temperature range. That being said, all the data shows the other things are going to be okay unless you really freeze them and crack the vial.
Okay, good. And you know what I also heard is that a lot of people, I think naturally, if they've used inhalers, I'm sorry, nasal sprays in the past, they have this tendency of inhaling it automatically, whereas with neffy, that's not the case. So
Exactly.
that's like another barrier, I think, not barrier, but one of the things that you have to be mindful of when you
Yeah.
administer that medication.
Yeah, we always remind people that you're not supposed to breathe in after using it. I think the other thing that will be interesting to see what plays out over time is that, the side effects being nausea and headache, to see after, there's more experience, like after people had reactions, if people that have used injectable before notice a difference or not. I don't know where that's going to fall, but it's just something that I've been thinking about.
And I have one more question, actually. You mentioned earlier about the role play with younger age group. Is this something you try to showcase in your office with the parent being present, or is it something that's in the handout that you give out with the stages that they can practice at home? Just the practicality of it.
I do both. I usually will sometimes feel out what's going on and get a sense of what the parents are worried about. Often for like the younger kids, I'll say, because someone's going to offer them a food they're not supposed to have because people just tend to feed other people's children. And that's often the thing that parents are most worried about. So I usually will say, or I'll try to offer something to a child. It's not usually a real food thing. And say, and see how they respond and what happens. And then we might work through that in the office too.
Thank you.
All right. So moving on to the young adults. So there's two sections for the young adults handouts that aren't in the others, which is managing food allergies at college and preparing to manage your healthcare. And so the young adults should be ready to take the primary responsibility to day-to-day food allergy management. Obviously, parents and caregivers should continually provide support, remind them they're not alone. Um, Family, friends, and roommates, of course, can be a great support, and confidence does increase over time. And so, I really like when the teens and the young adults come in with their list of questions because I know they've then thought about what they need and what challenges they're having. And so I do try to always direct a lot of my stuff to the teens. Sometimes the parents are still there, sometimes not. But I do encourage teens through the teen years to be more and more independent. We always offer one-on-one time, and then we also remind them to think about strategies of how to refill their prescriptions and remember when they need them. And then when they go to school, to know where the nearest hospital or medical facility is. And it's important, I think, before kids decide where they're going, to know what the options are at different schools about healthy eating and ways to stay safe. Most of the schools have students register with the Disability Services Office. And it's important if you can find out how food is prepared in the dining rooms and how students access allergen information. I've seen tremendous variability in this. This is actually an area that we're studying now. The other issue is, what happens if they can't make it to the dining hall because of their class schedule? What other safe options are available for kids? And then some schools have emergency plans in the dining facilities. Some may have EPI, others may not. And then kids may want to think about, do they want a room with someone that has a food allergy? Do they prefer to room with someone that doesn't have a food allergy? If the other person has a food allergy, do they want it to be the same food allergy? Do they need to speak to their roommate about having their allergens in their room versus not? Do they want to confide in their roommate that they have food allergies? Do they want their RA to know? What is the plan in an emergency? And then also having a fridge and a microwave can be helpful if they need some extra food, but is it not feasible to eat in the dining hall and is a kitchen needed? So the more of this that can be discussed up front, I find the better the things go. And so the whole reason we did this and we thought this was important is we've recognized that ongoing education is really important and that the challenges are different at different ages. And as kids get older, they have a better understanding of the differences between themselves and others. and they want increased independence and should have increased independence. And we were really hoping to provide a roadmap to independent care. And we were hoping through doing that that we would improve quality of life, safety, comfort, and self-efficacy. So this is again how to access the handouts and some ideas for using them. We sometimes use them during visits. Families can use them online. Families can use them to educate others. And generally speaking, I think the feedback has been pretty good. And we also include in the handout resources for further management that address reduced cost programs, accessing mental health professionals, patient support organizations, etc. And this is the group of us that worked on this. And Jenny, who's all the way on the top left, was the one that spearheaded this project. And I really think did an amazing job putting everything together. So thank you for listening. Any other questions? I'm going to stop this so I can see you. It's more fun seeing you guys.
Thank you so much for doing this. And actually, a couple of people on that list you just showed. Dr. Herbert is coming to join us in September 4th. So I hope you guys will
Nice.
join. Yes, she'll talk about social emotional issues related to especially the more novel treatments that are entering the immunology specialty, because there's a whole host of issues that I think people are experiencing when they're studying, adjunct therapies. So then we also will have a speaker series with Dr. Amanda Cox coming up in October. And then December, we have a global international nursing panel from nurses from around the world, including our members from Australia, Hong Kong, Europe, and we'll see maybe from Africa as well. But I'm looking forward to more sessions. So thank you very much for a very, very insightful talk today. And we did include some resources in the chat, and we are now opening it for Q&A. So if you have any questions, you're welcome to unmute and ask or post it in the chat.